Hello, my name is Emily Sowers, and today I'm presenting a policy proposal focused on reducing healthcare worker burnout through the integration of animal-assisted therapy into the federal and state workforce wellness policy. Burnout among healthcare workers has reached crisis levels in the United States. More than 62% of nurses report experiencing burnout during their careers, and 31.5% of nurses leaving the profession cite burnout as the primary reason. Burnout contributes to emotional exhaustion, reduced job satisfaction, and high turnover, and it threatens patient safety and healthcare system stability. Despite national recognition of the crisis, current policies do not require healthcare organizations to measure burnout, report it, or even implement evidence-based interventions. Animal-assisted therapy is a promising low-cost intervention for improving staff well-being and reducing burnout, yet it remains optional and inconsistently implemented. To address these gaps, I propose a coordinated federal and state policy strategy that integrates animal-assisted therapy into existing burnout mitigation frameworks. Congress should amend the Dr. Lorna Breen Healthcare Provider Protection Act to explicitly authorize animal-assisted therapy as a fundable and evidence-based intervention with the Health Resources and Services Administration, existing mental health and resiliency grant programs for healthcare workers. This amendment would add statutory language allowing grant funds to support animal-assisted therapy programs delivered in partnership with the certified therapy or animal organizations, including program development, training, evaluation, and implementation in high burnout settings such as emergency departments, ICUs, and rural clinics. Federal recognition of animal-assisted therapy would alleviate its optional wellness activity to a nationally supported workforce strategy. Professional organizations such as the American Nurses Association and American Association of Nurse Practitioners can strengthen the policy by developing AAT implementation guidelines, issuing position statements endorsing the amendment, and mobilizing members to advocate during federal policy cycles. APRNs, especially PHMPs and nurse leaders, can support adoption by designing AAT programs tailored to clinical settings, leading burnout measurements and evaluation efforts, and presenting evidence-based proposals to organizational leadership. Concrete implementation examples such as the HRSA-funded AAT pilots in Texas Safety Net hospitals, rural clinic AAT programs paired with resilience training and multi-site learning collaboratives that share protocols and outcome data. Together, these actions would be a scalable national model that reduces burnout, improves emotional well-being, and strengthens healthcare workforce retention through a federally supported evidence-based intervention. These reforms create a comprehensive policy infrastructure that mandates burnout measurement, expands access to effective interventions, and aligns federal and state funding to reduce burnout. By integrating animal-assisted therapy into federal and state policy, we can meaningfully improve emotional well-being, strengthen workforce retention, and support the healthcare professionals who care for all of us.